Hey guys, welcome back to the Pulling Curls podcast. Today on episode 208, we are talking about the birds and the bees and how to have that conversation with your kids. Let's untangle it. Hi, I'm Hillary, a serial overcomplicator. I'm also a nurse, mom to three, and the curly head behind Pulling Curls and the Pregnancy Nurse. This podcast aims to help us stop overcomplicating things and remember how much easier it is to keep things simple. Let's smooth out those snarls with Pregnancy and Parenting Untangled, the Pulling Curls podcast. Okay, guys, before we get started on today's episode, it is not a child-friendly episode. We are discussing some things that you should talk about with your kids that maybe you don't want your kids to know about yet. If you have had the whole conversation from start until I finish, and I mean finish, then they would be welcome to listen to this episode. But I don't know. I probably wouldn't bring my kids into this one yet. So today's guest has been a sexual health educator for over 25 years. She is the owner of Birds and Bees and Kids. She has a lot of great information about talking to your kids about this topic. I want to introduce today's guest, Amy Lang. This episode of the Pulling Curls podcast, Pregnancy and Parenting Untangled, is sponsored by Family Routines. If you are looking to get into routine, which makes conversations like this a little bit easier and gives you more margins in your day so you're not as stressed out, check out Family Routines. You can find it in the show notes or at Pulling Curls. Hey, Amy, welcome to the Pulling Curls podcast.
Hey, thanks for having me.
Yeah, I'm excited to talk about this subject. All my kids love it when I bring up the birds and the bees, but my stories are just scary. So nobody wants to hear the labor nurses' stories about the birds and the bees. So I'm excited to have you here. Because maybe you're not as, I hope you're not as scary.
I have my moments. Labor and delivery is different than I'm at the upfront end. You're at the end.
I'm like, let's talk about syphilis, guys.
Yeah. Who doesn't love to talk about syphilis? I love talking about syphilis. I'd actually just talked to somebody about syphilis when I explained how it worked. They were like, like they didn't know.
Yeah, I have to tell you that I went 15 years of being a labor nurse and had never had a positive syphilis patient. And then probably year 16 or so, we started having some, and now it's just skyrocketing. It's crazy.
Oh, I didn't know that. That's terrible. I'm really sorry to hear that. That's not a good thing.
So This is good information to give your kids, guys.
Yes, get ahead of it. Get ahead of the SIF.
Yeah. Okay. So when do you recommend that parents have that first initial talk, or do you recommend to have that talk?
So what I recommend is looking at this like a process. So just to be clear, most folks don't start the process when they probably should have, but the real first sex talk is using correct names for private body parts. So saying when you're changing your kid's diaper, that's penis, that's your vulva, and using the words. So that's the very first sex talk. And then, talking about bodies and boundaries and families. And then the ideal time to get to the reproductive penis and vagina business is about 5. So it's young, and people often have a little, maybe tiny or major heart attack when I say that, but let me justify my philosophy. So if you look at like the Netherlands, where they have the best teen sexual health outcomes in the world, they have several things going on. First of all, they have comprehensive sexuality education starting in kindergarten, going all the way through. So there's no not knowing. Very open culture about sexuality. They see it as a healthy, normal, natural, cool part of life. And that combination of things, what that shows us is that kids who have lots of sexuality information from very early until, it doesn't really matter anymore. Well, it always matters. They do better. And so that's part of the reason I say 5. A couple other reasons I say 5. 5-year-olds are really open. They don't know what we know about sex. They're not coming into the conversation with, syphilis. Sorry, that's terrible. They're not coming into the conversation with like baggage, right? Like we know what sex is. We've had sex. We know the good. We know the bad. We know the in between. They don't know any of that. So when you say to a 5-year-old, this is how butter is made and this is how a baby's made, it's the same to them because they don't have all that baggage. The other reason why 5 is a really good time is they're starting kindergarten. They're hanging out with older kids. As you may recall, there's playground chatter. and lots of misinformation. They also just are naturally curious about the world. And the cool thing about starting sooner rather than later is that they see you as their go-to person. Like they know you're the one. It becomes a normal part of your family life. So when you're like, hey, pregnant person, hey, they got pregnant they used a surrogate. Like that's not a big deal. Or talking about syphilis when they're older, right? It's like might be annoying, but they just know that's how you roll in your family. And then the other thing for me, because I didn't know this when I started my company, I was like, oh, 10. I had no idea. But the other thing is that studies have shown that kids who have open communication from a very young age about sex and bodies and relationships, they are safer from sexual abuse. So for me, I was like, all right, 5 seems young, I'm all in. Right. I mean, so those are the 5. Those are the reasons 5 is the time.
Yeah, I actually really like that because also at 5, you learn that there are parts of your body you don't show
Right.
at
Right.
school, especially. And
It's
you don't want to
cool.
see anyone else's parts either. Like,
Right. Because trouble.
yeah,
Trouble.
yeah.
Yeah.
So I think that's a great idea. And I think a lot of people think that the talk needs to be comprehensive. The first one has to be all of the birds and all of the beads, where you just start off with these are the parts of our body. My son calls them the no-no zone. He's still 19. Somebody told him this is my no-no zone. And I was like, okay, whatever. Anyway,
That
you just
works.
tell him, where you have a bathing suit basically is areas you don't need shown off, right?
Yeah. Or share. So yeah, we used to, talk about this in a way that was really negative, like the no-no zone. And now the language you use is safe touch and unsafe touch, because there are safe touches. And that is like, hugging, fist bumping, high-fiving, that kind of thing. And then unsafe touch would be to touching people's privates or showing each other privates and that kind of thing. And because the reason we need to use that kind of language is because it's connecting, it's kind, it's calm. No-no zone is shamey,
Right.
right? And I mean, I'm no judgment here at all. And it's kind of hilarious now that he's 19 and says no zone. So I think just thinking about like the sexuality conversation in general, it does start with bodies and boundaries. And then we always need to be talking about bodies, boundaries, and consent. And yeah, you don't sit down and lay it all out. And the best way to talk to your kids is by using books. The Roby Harris books are awesome. It's So Amazing is comprehensive, it's sex positive, it's detailed, so you can read it together. They can look at illustrations of privates, which is a much better and safer place to learn about them than, in the classroom or on the playground or wherever you may go. And then the other thing too is like you're already reading, it's a normal part of your family life. So why not throw in some sex books? But, it's not like don't do to your kids what we're doing right now. Right. The kind of rule of thumb is like over their childhood and into their adolescence, it's like 500 2-minute conversations. So just short, sweet, conversational, fun, goofy. It's okay to say no zone once they know that that's their penis or vulva area. Right.
Right.
Yeah. I haven't said the word penis to Milo. He's 22 since he was probably 6. So I said tinkle waggle, junk, business, no zone. Hilarious because it lightens the mood. And I knew he knew. Right.
Right. I agree that you can be kind of silly when you talk about those parts. I'm always surprised all the fun words people have for their birth canal. So that's Fabiola in my Fabiola. And I was like, I'm sorry, are we talking about the birth canal when we speak of Fabiola? And I was like, great, let's do it.
It's really funny and good. Down there is pretty fab. And the other thing too, like this, there's a vagina down there, but you can't see the vagina. What you see is the vulva and the labia. So having this language change up. I mean, Oprah did us a real good thing when she talked about the vajayjay. So close, but also so not quite right because, the equivalent of penis is vulva. So, and it means covering in Latin. Vaginas are down there, but it requires, work to check it out.
It's
Right.
a hole.
So, right. It's a hole.
Yeah.
It's only part of the whole shebang. So using, that's another thing, like saying vulva is really good because it's a word that not a lot of folks use. And if a child is being, unfortunately, we could go here for a minute. If someone is messing with them and like, there's this story about a teacher who said she had a student who, I think that she was 7, who said, hey, teacher, grandpa touched my cookie. And the teacher said, oh, honey, you should share your cookie with your grandpa. A couple days later, grandpa touched my cookie again. Oh, honey, We talked about this. You should share. And then she did it again. And finally, the teacher said, what do you mean by cookie? And she pointed to her crotch. And if that child had said, Grandpa touched my vulva, what would have happened?
Bells and whistles.
Bells and whistles. So yeah, I know this is a little depressive, but the thing is that when you're using correct language and you're talking openly and your kids know that, sex is for later in life, it's not for kids. Also that it feels great and should feel great. When they know that, they're safer. They're safer. And, in our world right now, there's so much bad information. Good touch, bad touch. There. Off the air, you all heard me. You didn't hear me trying to get away from like safe touch not sounding right. Like all the porn consumption and all that they're exposed to, it's really hard on them because they don't have the capacity to process what they're seeing. And most families aren't talking openly about sexuality. So there's no buffer for that.
Yeah. Side note, I hate the word vulva.
I did too, but it's not as bad as scrotum.
Nope. I prefer
scrotum.
I don't know. I just cannot get over vulva. Moist vulva is like the worst. Right?
Yeah,
which is pretty much where I spent my entire career.
I know. Well, youth. I also hate youth, which you put some of those words together real bad. Real bad. Yeah. I mean, people aren't used to saying vulva. It means covering in Latin. It's, we just have to adjust to it because vagina is not accurate. It's not what you can see. You can't see.
It's the whole.
It's the whole. It's vulva. Vulva. Say labia. If you can't say vulva, say labia. But vulva. Like I want a t-shirt that says Vindi Vici vulva. No one would notice.
I do not want that t-shirt.
Okay. I won't make you one. I won't send you one as a thing. Okay.
I do have to say that it is shocking how many pregnant women I've had we have 3 holes talk with them because they all think they only have 2 holes because when I put in the catheter, they go, how is the baby going to come out?
Oh boy.
And I'm always like, it's in your pee hole. And they're like, right. So does it come out when the baby comes out? And I'm like, do you think you're having sex in the same? I don't say that part. I just draw on the board. We have 3 holes.
So everybody should know, no matter what your parts are, they should know there are 3 holes down there. Right.
And we know these people have had sex by the time they see me.
Right. And they just haven't put it all together. They might say, I think people sometimes think pee comes out of the vagina because they know they have a hole down there and they might not understand. So this is why it is so important to save your kids, the humiliation of not knowing what the parts are like. And, everybody needs to know about everybody's parts. It's not just, your own. It's not just that, right? And again, if we look at like just the sexuality education, a lot of what we've done historically is about prevention. Like, don't do it. If you do it, then you got to be safe. We don't want you getting syphilis. Is this the most time you said syphilis in your podcast? Good to know. We've been in this preventive mode and we really need to change it into preparation, right? Your person who can get pregnant has every right to know what exactly is going to go down when that happens. I think it also can be like a little bit preventative too, but like they should be prepared for this part of life. It is the biggest thing we do. There's nothing bigger than being sexual and being in relationships and all of that. People get so worried about their child's, their grades, right? And it's like, yeah, getting an A in trig is going to take you so far. Not having any sexuality education or relationship education, that's going to mess you up, right? So we have this, like, it doesn't make sense to me that we don't focus as much on relationships. It's broader than just parts and holes, right? Relationships, sexuality, all kinds of things, right, that are related to this. And so, yeah, your kids' grades are important, but they're not going to take them very far. They might get them into Harvard. Wait, hardly anyone gets into Harvard, right? But they're going to be in relationships and a sexual person their entire life. So I really wish that parents would make this more of a priority. And the easiest way to see how important that is just to think about your own experience. Were you prepared? Has that trigonometry served you in your regular life?
I mean, it's all geometry, right? You're putting a perpendicular line in a pair. No, just kidding.
Right, exactly. I mean, you could probably like draw a line there, but this is just as important. And like I said, like look at your own experience. Like, did you have what you needed before you had those first romantic relationships? Did you feel confident in your own self and in your body and, understanding how things work and having some sense of what you might be comfortable with? Like did you understand consent?
Yeah.
right? I mean, consent is complicated, right? I mean, I've had sex with more than one person, maybe more than that. And, sometimes I had sex where sure I would consented, right? Like I did it, even though I was like, I did it to get out, like it was easier than saying no thanks. I was sexually assaulted, but just overall, the choices I made, was that real consent? Did I know what that was? So it's always going to be complicated. But if we're never talking about it for both partners, right? Doesn't matter. If everybody has this understanding of what this is, it's going to go better. People are going to feel better about their sexual experiences being on one end or the other,
Yeah.
receiving, giving, right? Or in the relationship. So, anyway, so TMI.
So, two thoughts on that. It also has a lot to do with health. I
Right.
think a lot of people don't realize how important that body is to your overall health for a long time, and how people might, ignore a smell or a discharge, because they just want to ignore it. Whereas if you brought them up, you know, all along talking about discharge or
Yeah.
whatever,
Yeah.
then that's just a part of normal life. Like they would talk about, a runny nose, right?
Exactly. Exactly. Yeah. And discharge, everybody needs to know about everybody, right? So, if you're a gay guy and your best friend is a gal and she's like, I got this chunky white business coming out of me, they should be able to say, oh yeah, does it smell? Like they should already know to be able to help. I mean, it doesn't matter. I mean, just everybody needs to know about everybody. And people don't know about discharge, right? Like as an adolescent, like suddenly things get amped up and you're like, what is this stuff coming out of me?
Right.
Right. And they should know. They should know. I think it's a fundamental human right. And it is about health, right? It is
Yeah.
about
Although my daughter likes to tell me way too much about hers. And I'm like,
health.
this is amazing. But I've talked about discharge with so many people. We're gonna have a very short conversation about this
Right.
and then it ends. I don't.
Right. How about this? Only talk to me if you're worried, right? Just talk to me if you're worried, if you have a concern. But if it's just the typical stuff, you know what? No thanks. We're
Yeah,
good.
this is a lot
Write
of
me a note.
information.
Write
And
me a
I
note.
was also going to say that so in our family, we do hope that kids wait for a long time. My husband and I, we were virginal when we got married, but we still definitely have these conversations because it's so much more about when they choose to have sex. It's about health. It's about who knows when they're going to choose to have sex. That's really
Right.
their own business.
You
And
can't.
also, it's appalling. Maybe it's Arizona, but what is taught in our health classes is completely useless. I could
Right.
not believe how poorly it is done.
I can, but this isn't my field. Like y'all don't have a great reputation. Yeah. So I'm just going to give you a language correction. Instead of saying virgin, it carries a lot of shame with it. So first time sex is what we say now. So losing your virginity, we try not to say that anymore because of all the shame and religious business that's attached to it. So the first time you choose to have sex, which you said, and yeah, you can't predict. And the only thing you can do is prepare them, right? And talking about your values is really important. So why did you two wait, right? Like why was that important to you? As opposed to saying you need to wait until you're well, really, I've determined like 25 is about the right time, mostly full brain development. Like we want you to wait until XYZ, not because our religion says so, not because you'll go to hell, not because that's what we did. Like, why is waiting important? And because that's more concrete, right? And it's helpful, right? If, like you say, like we said to Milo, we hope that you're in a loving, committed relationship, that this person who's straight is your girlfriend, that you're able to talk openly about birth control. And if one or the other of you, if your partner's had sex before, that you can talk about STIs and get tested and like you feel comfortable enough with them to talk about all this stuff. And then I said, and 25. So we didn't get 25, but like laying it out like that, it makes them think a little bit like, is this person, how do I know I'm in a healthy relationship? Like, what does that look like? And because that's more helpful than just this hardcore, just wait. And yes, so here's my thinking about terrible sexuality education. Like I live in Washington where we have comprehensive sexuality education from kindergarten through high school. Yay, our kids are going to do way better than your kids. But even if it's terrible, let them go because it's just fodder for excellent conversations. And so if you're already queuing them up, if they know, they should know basically everything by the time they start middle school. And so if they're off to their, fifth grade puberty class and they already know all the things and more, it's very entertaining for them to be in that class. And then when you look at the curriculum and they're like, yeah, that's like bullshit, right? Like, here's how this really works. Or, I mean, I know you've seen this, like when you were going through your nursing training where they showed you slides of STIs with people with STIs, right? Remember those?
It's painful.
It's painful. They're so awful. And you will never, ever, ever, ever see anybody's penis looking like that.
I mean, I might.
You might, but you're down there in the business land way more than anybody else is. So, values are a huge part of this conversation. And no matter how much you talk, your kids are going to do what they're going to do. Average age of penis and vagina sex is 17. Everybody's done something with that's last name is sex by about 19. I mean, we're talking like 80 something % of folks. So they're going to do stuff. And they have a right to be well informed. They have a right to be well informed.
And I mean, I just figured the school was going to supplement. And one thing I wanted to do was to look at what the school was talking about to make sure that I talked about it all in advance. Because I didn't go a lot into HIV because honestly, that's a low concern for me personally because I don't see a lot of HIV patients, whereas I do see a lot of chlamydia, gonorrhea, syphilis. And I wanted my kids to know how things like that would get treated and who they could see for it. And then it's super easy and the importance of antibiotics.
Yeah. Yeah. Right. With all that practical information, they still need to know about HIV because it's still really out there.
Yeah. Really, but honestly, at HIV at this point, I think more, I don't know. I don't think of it as a blood. I mean, it is an STI or whatever, but it's also lots of other ways. I don't know.
Yeah. But everybody needs to know about chlamydia, right? My joke is it's the common cold of the crotch. Sneeze and get it. Yep. Sneezing. Did you wave your vulva next to a penis? Okay. Sorry. Not to terrify everyone. I'm not a medical professional. It's incredibly easy to get.
Yes. And also the vast majority of charts we look at on first prenatal visit do have it and get treatment initially. So
wow.
It is. We're recording this in April, which is National STI Month.
Yes, it is.
Fun facts. Facts for everybody.
Yeah.
I bet that's not a month you've celebrated at your family, kind listener.
No, I'm sure not. But maybe you did. Maybe you were in a family that did things like that.
Yeah.
I hope not. Let's have a theme dinner. No, let's not.
Like a banner in your house where you're, 1 month it's happy birthday. The next month it's happy STI free.
Yeah. STI free zone.
Yeah. So what's your best advice for a parent who is super uncomfortable with it?
So my best advice is kind of what we just talked about. So to start this process, you got to take care of you. So just thinking about what was missing for you. That's the first thing. What do you wish you had known? Who do you wish, what kind of information do you wish you had known? Would you've made different decisions? So looking at that, what was missing for you, talking and thinking about your values. So which basically comes down to kind of what do you hope for your kids, which is part of this preparing yourself process. I was going to hiccup. And then, so those are two things. If you're parenting with someone, talking about it, like your values, right? What do we hope for them? And you might be on different pages about the whole thing. I did a talk last night and this couple came up to me and she was like, I need to ask you a question. I'm like, what's up? And I'm looking at this guy and she's like, oh no, he's my husband. When is it okay for someone to have sex for the first time? I'm like, sister, I can't answer that. And then went on to, what about kids having sex at home? And I'm like, how old are your kids? 5 and 9. I'm like, A, you got a long time to think about this. And B,
hopefully not yet.
Right. Not yet. Right. You need to decide, is this a safe place? Is not a safe place? What are the rules in place about that in your family? And they were okay. But having that conversation. Now, if you have a 5 and 9-year-old, don't worry about the sex at home thing. Just take that off the table. So that's the first thing, to get yourself ready. The next thing is to get books. Like my book, Birds and Bees and Your Kids, is all about clarifying your values and figuring out how you want to have the conversation, and then tips for having the conversation. So doing some homework yourself. And then the easiest way to start the conversation is to get books for kids. So we'll have them in the show notes. I love Roby Harris's books. And so then with the books, you need to read them all yourself. They're going to feel like too much. And just trust me when I tell you, it is not too much information. It is virtually impossible for us to give our kids too much information. So if you got a sweaty upper lip, you're in good stead. And then read the books, and you will discover that your kids are pretty open to the information. And it's okay to say, I'm uncomfortable. Like, I am so uncomfortable, but you need to know this stuff because I want you to feel really great about yourself as a sexual person and have really healthy romantic relationships. And then push through. No one will throw up. Promise.
I actually have a friend whose daughter I think did go throw up after they had the talk at about
Very
8.
Very rare. Very rare. Very rare. And some kids are really sensitive, right? So you know your children, but if they say, I don't want to hear it, or you think they're too young, you're not. It's, you know, like, you don't, it's not their job to decide when this happens. Like, your kid's not steering the ship. It's you. Like, if they say, I don't want to hear it, you say, I get it. I would have been uncomfortable too, but you need to know. And then the other thing you need to say to your children, is this: it's very fun to be the smartest kid on the playground when it comes to this stuff. And it is. And it is, to be full of information and watching them flounder around and their friends be kind of stupid, and you holding knowing the stuff. It's really good for their egos.
Although I always told my kids they could give a fact, but they always should divert them back to their parents. Like, if they were talking about that kind of information, especially in elementary school, because we probably had the talk before most of our friends' kids had the talk. I was like, it's not something we talk about on the playground. If somebody has a question, you can answer it, but always send them back to a trusted adult.
Yeah, that's really good advice. And I also say to say things like, you know what, we're really open in our family. You know, you can ask us anything. We're going to tell you all kinds of stuff, but other people feel really uncomfortable about this. So it's not your job to tell other kids about this part of life. And I also just recommend saying, you could get in trouble. People are really weird about this. Not us. You won't be in trouble with us, but just so you know.
Yeah.
A little of that. And then you just cross your fingers, right? Like, your kids, you're on the playground and one kid says, what a BJ is? What's a BJ? And they're having a BJ conversation. And one of the kids says, well, it's got something to do with blowing. Well, blowing what? Like, blowing on blowing on a dick, right? And so your child's like, oh, no, there's no blowing involved. And we're talking maybe like 5th, 6th graders here. And like, there's no blowing involved. And then your child corrects, right? And that somehow gets back to you. Your job is to just say, like, hey, I am so sorry they said they had this conversation with your kiddo. We'll remind them that it is not okay. That's not their job. Da, 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 da. And then that parent is going to do what they're going to do. And then I just recommend you say, you know what, in our family, we are really open about this because we want our kids to get that information from us, coupled with our values. And, it's just really important, in our family. So we'll remind them. And then you just let that parent spin out and do whatever the hell they're going to do. Because at the end of the day, your kid was right. And the other thing that's happened is that you have established yourself as a trustworthy adult for that other child, which is really important. Because if you're open with your kids and it's a good friend of your kids and you're open and talking about this and they know that, if something happens to them, they're way more likely to confide in someone that's one off from their trustworthy adult. So that might be you, which I think is a real position of privilege.
Yeah. The other thing we do is we put it to music at our house. We love to we call it chastity. We have a song of chastity that ends with "Keep It in Your Pants" with jazz hands. Yeah. Nice. And also, if anybody watched Schmigadoon, they have a great one about how the baby is made. So my daughter loves to pull that up on YouTube and sing it at full bore. Yeah.
Excellent.
It's just
Excellent.
fun.
Music is important. Music is important. Amaze.org has really great videos for kids that are animated and they're really funny. And there's one song that's called How the Boner Grows. So we'll put that in the show notes. Yes.
Wow. There's a lot.
How the boner grows.
I think you have to tell yourself, yes, it's uncomfortable. And it's probably mostly uncomfortable because of how your parents did it with you. But I consistently think that I want my daughter to have everything better. She recently got her period and I was just like, it is better than it was when I was a kid. Like, we just bought a period swimsuit because I knew that she wouldn't want to go through the whole, I want to go to the pool. We're in Arizona. We live in the pool in the summer and I don't want to use a tampon. I'm too little for that. Like it was just miserable trying to do it the first time. So
Yeah,
I want
totally.
things to be better, and it all starts with us just making it more open conversation. And I will say, as soon as she got her period, she texted all of her friends, whereas I kept it a complete secret.
Mhm.
I didn't want to tell anybody. And I'm so glad that girls today are just like, great, I'm going to be your period buddy. If you ever need help in the restroom, come get me. I'm going to bring extra pads, all this kind of stuff, because they were going to camp the next day, of course, right?
Of
Because,
course. Of
yeah,
course. Yeah. And it's much better, right? It's much better on many, many fronts. And so, like my belief is that in your family, you need to be a little Netherlands, right? Which is what that is, right? Hey, I'm texting everybody. I'm open about it. Like I'm ready for it. That's how they roll for all of it. And, as you're an outlier. You were an outlier parent talking so openly about this. And that can be a really uncomfortable place. But if you're convicted that this is the right thing to do for your kids and your family, then do it. Like going along with everybody else doesn't get you anywhere. Like we're
yeah,
all adults. We know that. And we know what happens when we go against our intuition, like our legit intuition. Like your intuition saying 5 is too young. That's something else. Like if you can get your rational hat on and think about you think about what I just said, 5 is not too young. It's better, right, than 15. Because I'm sure you've had patients. Like what, just out of curiosity, what's the youngest patient you've ever had
12.
delivery? Yeah, I'm not for that.
No,
I am
no.
not for that. I'm not for that. 14, no. 16, no thanks. 17, nope. 25, good. I mean, I'm being funny, but yeah, we don't want 12-year-olds to get pregnant. No one
Yeah,
does.
there is just no good outcome at 12.
No. Mm-mm, mm-mm. Did she parent?
She kept the baby. Yeah.
Yeah, I know somebody who, same thing, 12-year-old kept the baby. And I was like, okay. That's not I just can't imagine.
I mean, she didn't keep the baby. Her mom kept the baby.
Right. Her dad kept the baby, right? Her
Yeah.
dad kept the baby. So anyway, so you can make it so that their 12-year-old does not become impregnated or impregnate someone, which is my last thing here. If you have a penis, you can make someone pregnant. In the end, you can get someone pregnant. So it is absolutely, with your penis havers, you need to make sure they understand that they are absolutely as responsible for pregnancy, more responsible. They can get someone pregnant 24/7 from the time they're 11 until they're dead, essentially. So putting all the pressure on those of us who can get pregnant to make the pregnancy not happen, that is not fair. We need to make sure our boys know that they are just as responsible, that they need to take full responsibility. They should have condoms all the time until they're certain, whatever. And there's a book called Ejaculate Responsibly, which I highly recommend. It's so good. And it's about what I just said. You have got to ejaculate responsibly. It's written by a gal who's LDS and she's hilarious and it is so spot on. So I can't say enough good things about that because it does take 2 to make a pregnancy. And the person who can get people pregnant all the time should be taking a lot more responsibility than they usually do.
That's a good point. We
Yeah.
only have a few days a month as a lady.
Right. We only got a little bit of time there, people. And like, if you can get somebody knocked up all the time, then how are you going to manage yourself in light of that? Anyway, she makes a whole bunch of different points around it. It's really, really, really good.
And
Really
every day. They can do it every day.
every day. They can do it 3 times a day. They can do it more. Yeah. Anyway.
Yeah.
Yeah.
All right. Good information. I hope you guys will think about how you can just advance the conversation just like one step forward, because you don't have to do, even at 5, you're not going the whole way with a 5-year-old. You're just one step at a time.
I'm going to correct you. Yes, you're going to go all the way with a 5-year-old.
So I'm going to disagree because I don't think you're going to talk about all the things.
No, not all the things. Sorry, not all the things. Sorry, let's clarify. No, not all the things, but you are going to talk about how people become pregnant, all the ways, all the names for private body parts, the importance of.
Well, and hopefully they already know those because you're doing it while you change their diaper.
You have people who think they have 2 holes. Come on. Right. So if you can just get the correct names out of your mouth, that's a place to start. And then get a book. Get a book.
Yeah, there are. And just think of it as basic anatomy, just like science. It's science, guys.
Yes. It's science, reproductive science. Remember, how butter's made, how baby's made. Same to a 5-year-old.
Yeah.
Right? Same.
Yeah.
Same.
All right. Great information. Thanks for coming on.
My pleasure. Thanks for having me.
Okay. I hope this was helpful for you guys. I would say we had the conversation at 8. I do think that starting to have it at 5 is probably a good plan, especially anymore, because I think more people are having it earlier. Whereas when we had it at 8, I would say the vast majority of my kids' friends had not had any conversation about it. And so I'm glad that it's happening earlier, but also I do think that it's just a one step at a time process where you're using the right words and then just giving them a peek at like how babies are made and then moving on with your day. And then you make cookie dough together, right? It's just a part of the day. So I hope you guys enjoyed this episode. Okay, we have some great episodes coming up. Next week, we are talking about the 5 things moms should avoid during pregnancy. And then the week after that, we're talking about health shares and how to pick if it's the right plan for you. Thanks for joining us on the Pulling Curls podcast today. If you liked today's episode, please consider reviewing, sharing, subscribing. It really helps our podcast grow. Thank you.